So thank you for joining us. You have found yourselves in the first traffic safety peer exchange that SCAG is hosting, focusing on crafting a safety narrative, focus on high injury networks. Thank you all for joining us. I think we'll get started and just continue to admit people, of course, as they join. So if you haven't already, do introduce yourselves in the chat just so we know who's in the room. That way we'll also know the feature's working for you. We are providing closed captioning at this meeting. If you'd like to activate or hide that feature, you can click the live transcript button along the bottom and choose show subtitle or hide it for you. So as I've mentioned, my name is Courtney Geary. I'm Program Manager for Public Health and Safety at SCAG. This is our first traffic safety peer exchange. I'll be facilitating today's session along with Pam Beer, one of our consultant supports on this project. And we are really excited to kick things off today with our first traffic safety peer exchange. So on the slide before you, you're going to see a handful of meeting logistics items. This peer exchange is supposed to run for about an hour and a half. And right now, all participant lines should be muted. If yours isn't muted, please take care to do so we don't get a lot of feedback. And at the end of each presentation, we're going to have Q&A. So if you have a question during a presentation, please go ahead, type it into the chat box, or you can raise your hand. And when we have a moment for Q&A, we'll ask you to unmute yourself. Again, our peer exchanges are meant to be participatory, and hopefully we can, encourage you all to, get in there, ask questions, and share comments. And if you do think of something later, because sometimes we do give a lot of information for folks to chew on, you can go ahead and reach out to me or any of our presenters today. I know that all of their presentations include, should include their contact information, so you can reach out to them directly. All presentations will be emailed to you, and that's how you'll get their contact information. So if you registered to participate, you find yourself here with us today, you'll get a copy of the presentation, and we'll also be posting those on our website, on our GoHuman website. So today's peer exchange, as I mentioned, is going to be focusing on presentations and information sharing on high injury networks, including local examples, specifically the County of Los Angeles and the City of San Jose, information on how to source your data, perhaps from UC Berkeley's TIMS website. And we're going to be sharing a nonprofit perspective too from the Los Angeles County Bicycle Coalition. And to wrap up, as I mentioned, we're going to be having some breakout discussions. So you're going to get some time to talk to the speakers as well as with each other. And to help kick things off, we are going to try to get a sense of your understanding of high injury networks. So we're going to launch a quick poll for you. And Edward is our audiovisual support. He'll be sharing that with us shortly. We are going to ask you, are you familiar with the concept of a high injury network? I assume some of you are who found yourselves here, but we also want to know, has your community developed a high injury network? We know of some in our region, in SCAG's region, but we're curious about how many have been developed. So we're going to let this go for maybe another minute or less. I think it's 26 seconds actually, or no, it's actually not counting down. So another maybe 10 seconds. We have nearly everyone in the room has voted. I do see that we do have quite a few folks who haven't yet developed high injury networks, and I think that's actually a great thing that you find yourselves here with us, and some who have. So hopefully, again, during the breakout discussions, you can, share your experiences or your interests really in developing yours and what challenges may exist for you. So thank you for responding to the poll. That's helpful for the presenter certainly to know your familiarity with the concept with high injury networks. Thank you. And with that, I think we might find ourselves going straight into our first presentation. So Edward will be launching that in just a second. Thank you, Edward. I'll be providing an update really on a quick update on our region's existing conditions, as well as a bit about our GoHuman program and our current efforts to support the development of a statewide guidance on high injury networks. So just give me one quick second. There we go. Okay, there we are. So if you want to advance one slide, Edward. There we go. So as many of you may already be aware, SCAG's region is vast and is home to nearly 19 or about 19 million people and about half the state's entire population and about 13 million licensed drivers. And each year, nearly 1,500 people are dying, 5,500 people are being seriously injured, and another 124,000 people are sustaining injuries in traffic collisions in our region. And we anticipate that as the region emerges from the pandemic, the rates of fatalities and serious injuries may continue to rise, particularly if we find people shifting away from using public transit or our shared vehicles. Next slide, please. There we go. So collisions are occurring in every community in our region. The map before you, you can see some of those instances in 2019. They're occurring in places like Thousand Oaks and Ventura, all the way down to El Centro and Imperial. However, the vast majority, more than 70% of our fatal and serious injury collisions are occurring in urban areas and on our local roads. Next slide, please. And across the region, about a quarter or 20% or so of our collisions are a result of unsafe speed. And that's important to know, as I'm sure many of you are aware, that as the survivability in a collision decreases, it does decrease significantly with increases in speed. And this information on these few slides and more detailed analysis, far more detailed analysis, is included in our Regional Transportation Safety Existing Conditions Report, which we just updated, and it's going to be linked to in the chat. It provides region-wide as well as county-level breakdowns for you. So we know, based on our existing conditions that I've just briefly touched on here, that we do have our work cut out for us. And in our efforts to eliminate these serious injuries, as well as these fatalities across the region, SCAG has taken on a variety of efforts, including these peer exchanges, where we can talk about how we can do more to advance traffic safety in our region, and our GoHuman campaign. Next slide, please. So the GoHuman campaign launched in 2015. It seems like it was just yesterday, but 2015. And it was launched to reduce traffic collisions, or help reduce traffic collisions, and encourage people to walk and bike more. And since then, GoHuman activities have expanded the conversation beyond vehicular violence into a whole suite of programs that mainly fall into the three categories highlighted on the slide before you. Next slide, please. Co-branded safety messaging materials can be requested right now on the GoHuman website at no cost. Safety messaging materials are co-branded with our partner logos using preset or custom messaging, and come in a variety of forms like lawn signs, banners, public bus shelter ads that you see on the slide before you. Next slide, please. So GoHuman also provides a kit of parts at no cost, and this is a really nifty thing to do in your communities. The kit is a set of modular pieces that can be assembled to demonstrate different street design treatments like parklets, bulb outs, crosswalks, median refuge islands, and protected bikeways. So again, this kit comes with marketing materials and really is meant to show how a street can transform into one that centers on our more vulnerable users. Next slide, please. So GoHuman just recently received 45 project proposals for Community Streets mini grants, which is a funding program meant to build street level community and resilience and increase the safety of people most harmed by collisions. We anticipate we'll be announcing grant awardees in the next week, and activations should be starting this summer. It's a really great program to apply for. Next slide, please. And finally, to round things off on the GoHuman side, we also have a new Community Ambassadors program, which is a participatory planning and leadership series taking place in the counties of Imperial, San Bernardino, and Ventura. These ambassadors are compensated for their time, and spots are actually still open in each county. So if you'd like, you can apply online at our GoHuman website to participate. You can also learn more about all of these programs, again, requesting materials, trying to really hopefully learn more about resources that are available to you right now to help with traffic safety programs in your communities. So next slide, please. So with regard to our topic at hand, high injury networks, recently SCAG kicked off work with a statewide team to develop recommendations on the definition and methodology for high injury networks. We're doing this as a part of implementation of the state's strategic highway safety plan. It's an effort to respond to recommendations from California's Zero Traffic Fatalities Task Force, which was focused on, finding and identifying ways that we could address issues related to high speeds. Next slide, please. So since last November, the statewide team has been meeting to catalog and review California's high injury networks, their definitions and methodologies. The slide before you lists a handful of those that were included as case studies. There are quite a few in California, and we're hoping to unearth or potentially fund in the future more so that, again, we can drive data-driven decision making. Next slide, please. And in reviewing all of these high injury networks, we identified a common definition that a high injury network is typically a network of designated corridor level segments where the highest concentrations of serious and/or fatal collisions is occurring, typically over the course of the most recent 3 to 5 year period of collision data. And the high injury network represents a defined prioritized subset of the overall transportation network. It's really not meant to be your entire system, right? You're just trying to find the highest concentrations. Next slide, please. So based on our review of California's high injury networks, we found that there were some core components, specifically those highlighted on the slide before you, such as the number of years of data. As I mentioned, about 3 to 5 years is typically dependent on. In California, many are drawing that data from Switter's data, sometimes from TIMS. And high injury network analysis is typically on corridors that are continuous and have comparable collision patterns or densities. And at minimum, they typically do consider all modes of serious and fatal collisions, including bicyclists and pedestrians. And typically there is an overall threshold established. Again, the high injury network is a subset of a roadway network, not the entire roadway network. So we did find these core components. There's a lot more detail in this report we've drafted. Next slide, please. We also identified some challenges that jurisdictions face in developing high injury networks. I expect that San Jose, as well as the County of LA, are going to touch on some of these challenges today, or you could certainly ask about them a bit more. Years of data, access to reliable data, the community's understanding of what a high injury network is, not having that robust collision data. What if you just don't have those high numbers to work with, or the data to work with? And then having the right software, staff resources, and sometimes, of course, our counsel, our attorneys have concerns about risk and liability. And so those are some of the challenges we've detailed within the report, though there certainly could be quite a few more. Next slide, please. And now in terms of implications of the work. So we've drafted this report, we've prepared recommendations on what we think the overarching definition for California could be, as well as some minimums for the methodology. And so what we're hoping is we'll be able to present this, what we're not hoping, rather we're planning to present this to the state so that these recommendations can be institutionalized at the state level, and perhaps a California manual for setting speed limits. Hopefully we can motivate more local jurisdictions to develop high injury networks and value them. And perhaps they may even allow locals to have more speed setting authority. That's a potential implication of the work. And so we'd like to share the report with you more if you're curious. So please do reach out to me. My contact information is on the next slide. Edward, if you could advance one slide. There you go. So my contact information is there. If you'd like more details about the report, we can talk about it in the breakout session if you're curious, or we can set up separate one-on-ones, because we do want to solicit more input from stakeholders and further shape really our recommendations before we go and share them with the state. And with that, I can conclude my presentation and we can get into the meat of the matter, really, hopefully delving deep into some local examples. And so next up, we have a poll question actually that we're hoping to ask you just in the chat, and Anna should be sharing that with you shortly before we get into the Los Angeles County Department of Public Works presentation. But I guess I should pause too to ask if there are any questions regarding what I shared. It was really meant to be introductory, but if there are questions, we can certainly field them right now. And so Anna has shared the question in the chat. We're hoping that folks who are in the room can respond. What you think the most significant benefits of establishing a high entry network could be. Hoping to get a sense of folks' reactions to that in the room. We can certainly scroll through them as you share them. And so, but with that, we'll leave that in the chat for now. You can stew on that if you like. But I'd like to welcome Eric Dunlap, civil engineer from the Los Angeles County Department of Public Works, to share more regarding the county's experience developing its high entry network. Eric works, as I said, as an engineer for the Department of Public Works, where he's involved with the county's Vision Zero initiative to eliminate traffic deaths. He manages the county's traffic collision data reports as well as traffic safety projects in our unincorporated communities in the county, which are quite significant. And with that, I'd like to hand it over to Eric to share his presentation regarding the county's experience developing their high entry network. Thank you, Eric.
Thank you, Courtney, and good afternoon, everyone. I'm excited to be with you all today and share some about the county's Vision Zero work. As I just started, someone started pressure washing outside my window. So if it sounds like I'm presenting to you from a river, that's what it is. But my goals today are to provide you an overview of how we developed LA County's high entry network and provide you a few examples of how we utilize ours. My goals for you, like the question said, if you have a high entry network, share with us a little bit about how you're using it in your jurisdiction, or if you don't have one, think about using one or creating one and how you might use it. I'll take the next slide. So as mentioned, I'm an engineer with Los Angeles County Public Works, and at Public Works, we deliver regional infrastructure and services, improving the quality of life for more than 10 million people in Los Angeles County. As part of this, it includes managing nearly 3,300 miles of roadway in the unincorporated communities. Next slide. So the unincorporated communities are really the areas of the county outside of the 88 incorporated cities. There are actually 120 of them across our beautiful county, and some you may have heard of are Altadena, East Los Angeles, Willowbrook, Marina del Rey, and the County Board of Supervisors is the governing body for these unincorporated communities. And county departments, such as Public Works, we provide municipal services to them. In fact, 1 million people call the unincorporated communities home. They are culturally, linguistically, demographically diverse, especially geographically diverse. If you think about the county, the southern portion tends to be a little bit more developed areas. And then you move north into the Angeles National Forest, and the far north of the county, you have the high desert and the Antelope Valley. And each of those areas certainly presents their unique traffic safety challenges. Next slide. So between 2013 and 2017, traffic fatalities increased 28% in the unincorporated communities, with on average someone dying every 5 days in a traffic crash on a county maintained roadway. And before I blaze forward, I really do want to pause and say, you know, there are probably very few of us here who haven't experienced some sort of loss as it relates to traffic crashes. And I acknowledge that there are different degrees to which we've all been affected. But I think if we slow down, I'm sure that there are names of people that you know that might come to mind, whether that be a family member, a friend, a colleague, a neighbor. And so really the work that we do every day is dedicated to those people. Next slide. And for this reason, the County Board of Supervisors, they directed Public Works and the Department of Public Health, the LA County Department of Public Health, to co-lead Vision Zero action plan development. The timelines on the screen, this is approximately a 2-year process, and the plan focuses on the county's Vision Zero efforts. The board adopted the plan in August of last year, and we are really grateful for the strong leadership of our board in championing the work to save lives. Next slide. So as Courtney mentioned, the definition for a higher injury network, if you were to give it a definition, really it's a network of corridors where higher numbers of people have been killed or severely injured in traffic collisions. And as part of our action plan development, we reviewed what other jurisdictions had developed. And a hallmark of these networks is that they really get you to the point where X% of collisions, typically a high number over 50%, occur on X% of roadways, like a small percent of roadways. And jurisdictions have found, this is an important starting point in really focusing efforts where they can have the biggest life-saving impact. I will admit that when we started this process, there was a little bit of skepticism when we embarked on it, if we would have this finding for the county. Regardless, we jumped right in and we started, and I'm going to take a couple minutes to review the finer details of how we created our high injury network. It's certainly a way, it's not necessarily the way, and a lot of it is up to you and your community. So I'll take the next slide. So really, regardless of your methodology, the first step is to identify your data sources and develop those data sharing agreements. Public Works currently has a process in place for receiving traffic collision report data from the California Highway Patrol. We receive the CHP 555 form. And if you aren't aware, the CHP provides traffic enforcement services in the unincorporated communities in response to traffic crashes. Now, when we receive those reports, we have a team that reviews them for completeness and accuracy, and they input them into a database. So this is a process that I think for as long as I've been at Public Works, that's been going on. And if you're a jurisdiction that doesn't have a process like that, or a relationship with your law enforcement where you are continually receiving traffic collision data, Katherine Chen from UC Berkeley Safe Track is presenting a little bit later, so hopefully she can touch on some of the collision data resources and solutions available through UC Berkeley in her portion. Next slide. So the first step is really you clean your traffic collision data. And what we did, we exported our data and reviewed it against other publicly available data sources. So UC Berkeley's TIMS data, available SWITR's data, as well as we reviewed our fatal and severe injuries versus the LA County's medical examiner and coroner's database to see if the injury level of crashes had changed from severe injury to fatal at some point. And where we found there were some discrepancies, we would consult the CHP 555 form or either work with the CHP to better understand the details of the crash. And I would recommend, if you're going to embark on this, take some time, review the crashes individually. You know your jurisdictions the best, and it will take time, but it's really invaluable in helping you better understand the safety trends in your community. In the 5-year action plan period we looked at from 2013 to 2017, it was approximately, I think, around like 2,000 fatal or severe collisions in our data set. So quite a few, but certainly manageable to review. Next slide. So after the collisions were mapped, our next step was to identify the roadways on our high injury network. And we used GIS software to do this. And this took probably maybe 2 to 3 staff people. It was myself as well as a GIS technician. And then my manager at the time was pretty involved with reviewing it and checking it and dialoguing about it. And our goals were really that the layperson easily understands the methodology. So we felt that identifying fatal and severe injury collisions over a segment length would be the simplest for a community member to understand. And we identified locations that experienced 3 or more fatal or severe injury collisions within a half mile over 5 years. The number 3 was somewhat arbitrary. We could have tried 4. That would have given us fewer streets. We could have tried 2, which would have given us more. And this includes all modes, so walking, rolling, biking, driving. And we decided to label the roadways on our high injury network as collision concentration corridors. The city of LA have preceded us with their action plan development. So part of that was to ease potential confusion from community members. And then also we felt like including the name collision in there might help a community member more readily associate the network with traffic collisions. Next slide. So on the screen, you'll see a list of assumptions that we made in drawing our collision concentration corridors. If you embark on this, you'll likely have to do the same. Do we count this crash or do we not count it? For example, right angle collisions, do you apply that to both streets? One street, 1 leg, 2 legs, 4 legs. In this process, my strong recommendation to you would be to not let the perfection be the enemy of good. There are certainly some decisions in here that it's a question of better or best and not necessarily right or wrong. Next slide. So after we finished this whole process and we totaled the collisions and the number of miles of roadway, despite my skepticism, we found that 50% of fatal and severe injury collisions occurred on less than 4% or 125 miles of the roadways managed by the county. And so, you know, Vision Zero is an ambitious goal. And I've worked on this team a couple years, and we continually read the reports that come in. And in some ways, Vision Zero can feel like a daunting task. It can sometimes feel like you're running uphill a lot. However, this finding or this network, in some ways, it really, I believe, started to give us a starting point that we needed. And it moved us from just somewhat chasing the dots every time a collision happened, like coming up with very like site-specific, location-specific countermeasures, and transitioning to coming up with broader corridor or network-wide strategies. So I'll take the next slide. So we had those 125 miles, and then we determined a priority score for each of those corridors by assigning weights for health equity, the severity of the collision, and whether pedestrians or bicyclists were involved in the collision. And the additional weight for health equity was assigned if the collision occurred in the lowest scoring quartile of the California Healthy Places Index. In preparing for this presentation, I looked at our analysis again, and I saw that around 30% of our fatal severe collisions occurred in these most underserved communities. And certainly, like looking at the percentage of the county's roadway network that are in those communities, it's certainly not 30%. And so we do see these communities disproportionately impacted by fatal and severe injury collisions. And so it was important that we emphasize equity and prioritize it just to ensure that we're continually investing in those underserved communities. Next slide. And so here are the maps in our action plan. I forgot to mention that we're grateful that SCAG was able to fund a portion of our action plan development through their technical assistance program. Maps of the entire county are available at visionzero@lacounty.com. And next slide. And so you've made your map, you know, we've made our map. However, that document alone isn't going to save lives. And so it's really going to be what you do with it that's going to make a difference. And I'll say that what you do with it is in some ways up to you, and it's up to your local jurisdiction. Naturally, we use it for Vision Zero project prioritization to prioritize engineering projects. Our partners at the LA County Department of Public Health use it to focus their traffic safety communications and education campaigns. It's also used in public health's pedestrian planning efforts. It's also a really great tool with working with Vision Zero partners. So as we were developing our action plan, we had these meetings with different groups inside Public Works in the Public Works team, as well as broader in the county. And we would show them a draft of the action plan, and we were curious, and we would ask them like, hey, if we were to publish this, I don't know, like what would you use it for? And doing that, it was really interesting, the responses that we got. We got a lot of really great practical responses. And one I want to highlight is our stormwater quality team. So we asked them, and then they were developing the county's like Green Streets master plan. And so they realized, oh, we can factor in Vision Zero to that. It somewhat commenced the point of collaboration. And we're collaborating with them a lot to develop stormwater capture facilities, so like bioretention facilities that also provide a traffic safety benefit, such as like a curb extension. So I would also encourage you, if you don't have a HINs in your network, to really open yourself up to non-traditional partners, to people who you might not think about working with, or whose work extends into or work with people whose work isn't specifically transportation. And finally, it's just a great community conversation starter with community members. In the past, when we would attend community meetings, and say you ask a resident like, hey, how do you feel about traffic safety in your community? The answers you get a lot of feedback sometimes about the person's street in front of their residence or in front of their home. And we always try to take a copy of our collision concentration corridors to meetings. And so when you can ask a community member, hey, like looking at this, does this make sense to you? Like, what are your concerns on the street? It's really a great tool to draw out a little bit more helpful input and feedback where there is a real traffic safety concern. And I'll take the next slide. So finally, like I said, it's how you use it, and it's really up to you. I encourage you to share with us how you're using your HINs in your communities. My contact information is on the screen. If you have any questions, please shoot me an email and let me know. And with that, I'll turn it back over to you, Courtney. Thank you.
Yeah, thanks, Eric. Thanks for a great presentation. I certainly appreciated it, since I haven't had a lot of time to spend getting into the weeds of your document yet. But I think people do have an opportunity here to ask you questions, right? So if people do have questions for Eric about LA County's experience developing its collision, it's a triple C, right?
Hey, you can use either synonym.
I want to call you
yeah, a
triple
CCC,
C.
collision concentration corridor.
Do you say it
HIN,
every time
yeah.
when you present it? It's a mouthful, but I want to respect the distinction you were drawing with that titling. So if people do have questions for Eric, feel free to drop them in the chat. I do have a couple for you, Eric, just from our experience looking at or examining some of the HINs networks that have been developed. Would you be able to identify perhaps the more significant challenge you experienced in developing it? Was it on the technical side, having the resources to do it, or was it, the community side or a political side, concerns about liabilities, for example? There are a lot of options there. Mm-hmm. So, yeah.
Yeah, I think probably the largest undertaking was really the data side, and getting it into getting your data into a place where you could go through the analysis and the exercise. That took a significant amount of time, a significant amount of my time, as well as like a GIS technician. And you certainly bring up some concerns, and we looped in our council as part of the process, and certainly they brought up concerns, but hopefully by you all seeing that we published our high injury network, a lot of those, hopefully you'll see that some of those concerns were addressed. And yeah, so I don't think the barrier didn't seem to be so much like the community. I think when we presented it to the community, we certainly in some ways they were able to ground truth it, and they were like, oh yeah, totally, like we know this, right? Okay. Like this is obvious, it was the most challenging part, at least for me, was kind of getting the data into a place where it could be done easier or simpler.
Okay. And I do see a question coming through from Victoria. Just curious if the data from the 555 and TIMS and medical coroner reports were more or less consistent with one another, or if there were notable distinctions.
So what we found is we received the CHP 555 forms, and sometimes those will be marked as a severe injury collision. And then there's a window, don't quote me on it, I think it's like 30 days. If someone succumbs to their injuries in 30 days and it's a fatality, then that collision might be marked as a fatal collision. And sometimes we found that we weren't receiving those supplemental reports. So by comparing our severe injuries to just the medical examiner coroner's online database that's publicly available, we were able to confirm like if that party unfortunately did pass away from the crash. That's how that was used.
Okay. And then just a final question for you, so we can keep on time. Do you have any tips for anyone just getting started?
Do I have any tips? I don't know.
You've come so far. It's been such a process that, yeah.
Right. I think really like, don't let perfection be the enemy of good. You can get through this stage, like get through your action plan and start implementing Vision Zero, because like I mentioned, like this high injury network by itself on paper is not going to save any lives. It's going to be really how you apply it and what you do with it. So be data driven with your process, be equitable with your process, but ultimately get something down and put it to action. and just kind of commit to evaluating it. So that's what I would say. That my advice would be not to let perfection be the enemy of good in this process.
Yeah, yeah. No, it's a bit of an art, I think, some of the work, right? Well, thank you. Thank you for sharing more again about your experience developing the county's high injury network. I know county is a massive, covers a lot of ground. So I can't imagine it was easy, but thank you for sharing that perspective at a county level. Now I'm wondering if we can share an additional question in the chat with folks to mull over. This relates, I think, to some of what we've been discussing. Anna will be dropping it in shortly. What are some barriers to establishing a high injury network? We have some examples I'd referenced earlier: funding, limited staff time, community support, political support, data, which it can be huge, or other. Anything you're comfortable sharing, we can also discuss in the breakout sessions later. But we want to try to get a sense of what the hardships are really for taking on this work. And with that, we'll let you mull it over, chew on it. But I'd like to welcome Jesse Mintz-Roth, Vision Zero Program Manager from the San Jose Department of Transportation, to share more regarding the city's experience developing its high injury network. Just want to share a bit about Jesse. He oversees staff of 8 who work on crash analysis, traffic safety education, safe routes to school, running the city's new Vision Zero task force, and state level policy work with other California cities. Vision Zero is a significant effort for the city. I'm sure you'll be sharing more about what that looks like for you, Jesse. So I'd like to hand it off to you, and Edward will be advancing slides for you. Thank you.
Great. Thank you for having me and for having a visitor from Northern California. Why don't you move on to the next slide? Just a little introduction to San Jose for people who are not super familiar with it. We have a population of 1 million people. We're the 3rd largest city in California after Los Angeles and San Diego, and the 10th largest in the US. We're 181 square miles. We're founded in the 18th century, but our major suburban growth in the 20th century, I think, is really the context for where we are in talking about Vision Zero today. Next slide. So a little bit about myself. I've been with this program for about 2 years. Before that, I came from New York City, where I also worked on Vision Zero. And so I'm describing a little bit about the origins of the program that predate me. San Jose adopted Vision Zero in 2015. There are 3 action plans, which you can see on the screen here: 2015, 2017, and 2020. The 2021 was developed while I was here. And I am going to talk a bit more about what to do with the document once you have it. So you can get some ideas with that. So our 2020 action plan was adopted on February 11th, 2020. It was right before the pandemic started. It established 6 priority action areas, and it was we got a lot of city money with the passage of the action plan, $6.8 million to begin, and we are guesstimating that it would be about an $18 million plan that we'll need to continue to ask our city for more money for as we proceed. And it really, Vision Zero complements our other city goals and policies: safety, working with, focusing on vulnerable modes, and also just mode shift towards more active modes. And the strategy, you know, for the overall Vision Zero program is that the data analysis that we do in GIS, for example, or other platforms informs our investment. So the next slide, please. So a little bit about the earlier action plans. Well, first off, high injury network I use on my slides is HIN, and it is the focus. It's the investment of our, sorry, I'm stating, it is our safety investment focus area. Our 2015 action plan identified 14 corridors, and similar to what Eric said, you will have a high percentage of fatal and severe injuries on a low percentage of streets. So in our first action plan, there were 14 corridors, and it says that 50% of fatal injuries occurred on 3% of the streets. Before I got here again, they added 3 more corridors for a total of 17 corridors. 15 of the 17 are within city jurisdiction, and 2 of the 17 are within county jurisdiction. So a little bit about the Vision Zero program within our DOT is that we are located on the operations side, which is fairly unusual. Vision Zero is pretty often located on the planning side of DOTs. We have a direct link with the San Jose Police Department, which sends us crash reports, and we maintain the database. So we have a staff person who takes every crash report and every injury, which, similar to what Eric was saying, is on the CHP 555 form, and that person inputs it into a database that DOT maintains. And while we have one staff person who's done that for a long time, we only had one shared GIS staff person across, I think, all of operations for a long time. So the GIS was a very limited resource issue going into the creation of the Vision Zero plan. And so we, did a lot of what Eric was describing with GIS in-house and created our action plan in-house. So the next slide, please. So this is our more current version of the map, and using our most recent numbers, which uses 5-year data, we tend to see on these 3% of corridors that the fatal and severe injuries are between 30 and 40%. Given the most recent 5 years that we've analyzed, which were 2015 to 2019, they are 38% of traffic fatalities and 34% of severe injuries. And similar also to what Eric was talking about with the Healthy Places Index, that's the state version. Up here in Northern California, we have another name for those areas, which is communities of concern, which is a term that the Metropolitan Transportation Commission uses, which is the analog to SCAG. So you can see those areas in yellow, and the Vision Zero priority safety corridors, as we call them here in the city, in blue on top of it. So the overlap with them is fairly significant. So while this data comes to us from the San Jose Police Department, we are working to get more data from more places to help better inform this map, to create sort of a future version of this map, hopefully. And the 2 data sources that we're trying to get a data sharing agreement from are the VTA, which is our transit system. Here we have on-street light rail. So for the light rail facilities that are in San Jose, the VTA contracts to the county sheriff, and so we don't have those records. And we've been trying to get them, and we're working on creating a data sharing agreement there. And the other data source that we're really interested in is the county's EMS, the Emergency Medical Services Department. They have the aggregate data for the county's 3 trauma centers. And San Francisco is the only place that has done a linkage between crash data and trauma center data. We also already have a relationship with the medical examiner corner, which Eric mentioned in his presentation. So let's go to the next slide. So how the high injury network is used. We've done walk audits and safety assessments with staff. We've created engineering assessments of how to reduce speed and minimize conflicts, although in many cases we don't have the funding to fund them. So we do spend a lot of time applying for safety grants from various sources. And as of 2020, we've received $25 million on these specific streets since Vision Zero was created. And then in the 2020 action plan, one of the major areas of that plan is to do quick build projects on all the priority safety corridors that the city owns, which is the 56 miles. Could you do the next slide? So I just wanted to do a little bit of data talk. I always do this when I talk about Vision Zero, but I think it's just useful because, you know, besides talking about the map, it's also useful to talk about the data. The context in which Vision Zero was adopted in San Jose, perhaps similar to other places, is that we really saw a really big increase in the last 10 years in traffic fatalities. So between 2012 and 2015, you can see that the traffic fatalities in the city doubled. And that the peak of 60 fatalities was reached twice in 2015 and 2019. San Jose saw a 18% decrease in 2020, but 2020 is a really unusual year, and so we don't really know if it's the beginning of a new trend or whether it's an aberration. Move to the next slide, please. We also look at it by street user type. So you can see here that the big growth area really from 2017 on to 2019 is people hit while walking, or rather people killed while walking. And we saw a significant decrease in that area in 2020, which is really interesting. But the next slide, I think, informs that more. So continue to the next slide, which is the median ages of people hit while walking they're our oldest group. So I think based on what we know in 2020, the older people would be best off staying at home. And I think that you can see in our data that they did. So here you can also see there was a spike in the median ages of people killed while biking, but that number is much lower. So basically, I think last year we had 7 traffic fatalities involving cyclists. So the age fluctuates more if there's a few older people. Continue to the next slide. One of the things that we also look into, and I have a word missing here, but top known factors leading to fatal and severe injuries. The acronym KSI stands for killed and severely injured. And so the top known factor leading to fatal and severe injuries in our 2016 to 2020 data is speeding. And speeding is far and away our #1. And our #2 is red light running. All the ones below that tend to change year to year. So that's why we have these top 2 identified, and they can really, having identified this can really help us in terms of the strategies we pursue. So you can see in speeding as a primary factor for fatal or fatal and severe injury. So in 2019, we had speeding as the primary cause on 6 fatalities, and in 2020 it went up to 13, more than double, and 13 as a percentage of 49 means that speeding was the primary cause of 27% of fatalities in 2020. Next slide, please. So these are the 6 areas of the priority of the Vision Zero action plan. And I'm not going to go into all of them here, but I will just briefly touch on a few of them. One of the things that I did want to talk about with the document is, once you have it, what to do with it. We report on these 6 priority action areas fairly often in the city here. So we go to City Council's Transportation and Environment Committee twice a year, once in May to talk about the previous year's data, and then once in November to talk about our progress on projects. We also created a Vision Zero task force, which is a best practice recommended by the Vision Zero network. Our Vision Zero task force was created in September 2020. It meets quarterly. We just had our 4th meeting. If you're interested in coming to it, they're public, but you can also watch our recordings, which are on our website, and our website's on the bottom left of every slide, visionzerosj.org. And the Vision Zero task force is made up of 20 decision makers. So just who they are, we have 2 city council people who are the chair and vice chair of the task force. We have 9 city department decision makers, 6 county department decision makers, and 3 local advocates. Next slide. So just on 3 of the areas, I mentioned before that we're doing quick build projects on the 56 miles of city-owned priority safety corridor or high injury network. This is our first big corridor project that's in implementation called Center Road. Next slide. And we are also doing a citywide collision review project, which we use to train our younger engineering staff. And so we selected locations based on injuries and fatalities. And in this roundup of locations, we have 14 of them on the priority safety corridors, AKA high injury network. So that 14 of the 16 really shows sort of the role that identifying these corridors plays in the safety projects that we're doing inside the department. But these are in addition to all of the Vision Zero quick build projects that we're doing on the corridors. I believe this may be my last slide.
Well, thank you, Jesse. Thank you for sharing more about a city's experience developing a high injury network. Anna's dropped in the chat a link. Hopefully that's a good link for you. If there are more, Jesse, you'd like to share in the chat for folks who want to consult your high injury network, please feel free to do so. I'll ask you just one quick question because I know we're a little behind, but do you have any quick tips? Any tips for anyone first starting out trying to do the work? Or maybe, yeah. Mm-hmm.
I would say it is a big undertaking. And I would say particularly for smaller municipalities that the access to GIS staff might be a challenge. And so that I would say is probably the most significant one in coming to, so I mentioned before that I worked for New York City. New York City had tons of GIS staff. Coming to San Jose, really a lot fewer. And so I would say that sort of understanding the data well enough to find the high injury network is, I would say, the sort of biggest technical challenge that's at the basis. So tips would be trying to build that resource if you don't have it, or trying to figure out how to access it.
Or how to perhaps apply for funding, right, to outsource the activity. I know consultant support can be a tremendous help, right, to some smaller cities especially, who just don't have those resources in-house. So maybe that's an option too. But having worked for cities too, I can attest to the fact of what you're describing with limited staffing and resources, and maybe one GIS person for all of public works. So yeah, that's a big challenge, trying to develop that resource in-house. Well, thank you, Jesse. Thank you. And I think the undercurrent or the through line for high injury networks is data. So our next presentation that will be shared is on how to use data to identify high injury networks. And we're very fortunate to have Katherine Chen from UC Berkeley SafeTrack joining us. We're gonna, again, throw a question in the chat for you to consider for all of you about where you might obtain the data that's needed to develop a high injury network. I know that some of those sources have been cited by Jesse as well as Eric, but if you have ideas on where, or if you want to share where you're getting your data or issues you're having, please feel free to do so in the chat. And so, as I mentioned, I'd like to welcome Katherine Chen, a senior policy analyst from UC Berkeley SafeTrack, to share more on how to acquire and use data to develop high injury networks. Katherine is a senior policy and program analyst at SafeTrack, where she coordinates multidisciplinary transportation injury prevention planning and research. And I know that from SCAG staff, we enormously appreciate TIMS. And so we're grateful to have you, Katherine, with us today. Take it away.
Thank you. So like Jesse, I'm also based out of Northern California. So thank you so much for inviting me to join you here today. My name is Katherine, and I'm a senior policy and program analyst at SafeTrack. SafeTrack, for those of you who aren't familiar, is a safe transportation research and education center. We are a research center jointly affiliated with the School of Public Health and the Institute of Transportation Studies, so we're multidisciplinary. Our mission is to reduce transportation-related injuries and fatalities through research, education, outreach, and community service. Quick summary of some of the things we do. Data. We conduct data analysis and models to identify crash risk, and we develop data tools to improve our understanding of safety and mobility. SafeTrack is also at the forefront of evaluating the benefits and costs of rapidly emerging technologies like crash warning systems and smart infrastructure. And then thirdly, we also conduct policy analysis and community engagement to improve road safety and encourage active transportation. Next slide, please. So in today's presentation, I'm going to go over the role of data in identifying high injury networks. Specifically, I'm going to go over why data, the importance of data, and the types of data to consider, a safe systems framework, and where the high injury network fits in, what a high injury network and systemic analysis are, and what is needed to develop them. And then lastly, I'm going to review some of the free mapping tools that SafeTrack offers through our transportation injury mapping system, TIMS. Next slide, please. So over the past decade, traffic deaths have steadily increased in California, peaking in 2017. The trend is even more glaring when we look at vulnerable road users who sustain a greater risk of injury when struck by a vehicle. In the context of transportation safety, crash history is the primary data set used. We use it to identify contributing crash factors in the road environment, roadway design, and behavior that lead to the higher frequency of injury. And while crash data has some limitations, it is also critical when we need to compete for data-driven safety funding at the regional, state, and federal levels. Thank you. Next slide, please. So there are many types of data that we use to need to understand this entire safety narrative. Crash data, as I mentioned, doesn't tell the whole story. For example, near misses are not captured in the crash data, but a community engagement tool like SafeTrack's Street Story can bring attention to some of these hazards. The list of data that I've included here is only an example of some of the other data sets we might want to consider. So under crash history, I list SWITRs, FARs, and CMOD. SWITRs is the statewide integrated traffic record system. It's the official statewide crash database in California, and it's maintained by the California Highway Patrol. FARs is the fatality analysis reporting system, the official federal crash database. And then CMOD that I mentioned here is the crash medical outcomes data. It's a project of the California Department of Public Health that links crash data to medical data. The next type of data that I wanted to talk about is exposure. So traffic volume and pedestrian and bicycle counts give us exposure figures to use in transportation planning. Figures like the annual average daily traffic is used to determine funding for roadway maintenance and improvements. Ped bike counts, like SCAG's active transportation database, allow transportation professionals and researchers to analyze mode shifts and trends in pedestrian and bicycle trips. So when we're looking at these injury numbers, it's really important to have a common denominator to compare against. For example, it's significantly different to look at 1 injury per 10 trips versus 1 injury per 100 trips or 1 injury per 1,000 trips. And then roadway inventory is important to understanding the crash risk of specific locations. So if a specific roadway design is contributing to a high number of crashes, perhaps it's inappropriate for this site. And then other kind of data sources to look at include demographic information. Similar to exposure, this gives us a denominator to compare across locations or jurisdictions. The census and the American Community Survey are 2 of the most commonly used. So within the crash database, race data is fairly limited and socioeconomic factors are not included at all. So as a result, we really need some of these race, population, and income information so that we can use that to address issues of equity, using that as the common denominator to compare across regions. Other data types that we might want to include are needs assessments, travel behavior, health data, and other quantitative and qualitative experiences. Next slide, please. Under a safe system, everyone shares responsibility for safety, including transportation planners and engineers who design the roads, policymakers who enact laws and policies, and individuals who should comply with the safety directives. And while transportation planning has historically focused on vehicle mobility, this new holistic view of the road system brings more emphasis to vulnerable road users and the need to create built environments that support active living and mobility. Most of us have heard time and time again that over 90% of crashes are due to human error. However, that 90% doesn't take into account numerous other factors that may have contributed to the crash. So rather than blaming the victim for the injury because of their behavior alone, the safe system approach asks us to look upstream. As Courtney mentioned, 25% of crashes are because of unsafe speed. So if a motorist is speeding, was it because the road was designed for a higher speed? Or was it because our policies prioritize throughput? Or was it really driver behavior? So the goal of the SAFE system is not to eliminate all crashes, but to reduce the most serious crashes. Next slide, please. A high injury network, as others have already alluded to, is intended to show where fatal and serious injuries are occurring, to identify corridors within a transportation network that carry a higher risk of injury. This helps transportation professionals focus limited resources on the most problematic areas, which builds public and political support for further safety improvements. It's an opportunity to strengthen multi-agency interdisciplinary collaboration, like Eric mentioned, because more often than not, high injury network streets are disproportionately located in lower income communities of color. So to develop a high injury network, a jurisdiction must have reliable crash data, usually 3 to 5 years, and enough crashes concentrated within a specified area. As a result, high injury networks are more common in urban areas with higher traffic volumes. Jurisdictions typically identify corridors to designate as their high injury network where the highest concentration, typically over 50% of crashes, are occurring. In areas where the data is not robust enough to develop a high injury network, a systemic analysis might be more appropriate. Next slide, please. So systemic analysis allows for lower crash numbers, but necessitates a broader understanding and inventory of land use and roadway features to identify locations with similar risk characteristics. For example, if you have 3 main intersections in your downtown area that have similar roadway characteristics, but only one intersection has a high number of pedestrian crashes, systemic analysis might allow your jurisdiction to be competitive for funding to make improvements to all 3 intersections at the same time, as opposed to just the one. Systemic analysis proactively identifies high-risk locations before a crash occurs and allows you to make these safety improvements. It complements the high injury network that focuses attention on the segments of the networks with the highest crash risk. So similar to the high injury network, systemic analysis requires crash history, mapping tools, and a general inventory of the roadway. The inclusion of demographic and volume statistics further strengthens your analysis. So you might be asking yourself, Katherine, if we don't have a data GIS person on staff, how do we get access to this data? Next slide, please. Next slide, please. SafeTrack developed the Transportation Injury Mapping System, TIMS, in response to agencies that lack the internal capacity to conduct geographic analysis of traffic crashes. Over the past decade, TIMS has had over 18,000 users, with about 23% from local and regional government. TIMS offers web tools that allow users to easily query, analyze, and export geocoded SWTR's crash data. This here is a dashboard of the tools featured in TIMS that range from general tools for data exploration to targeted tools for focused analyses. Our newest tool in the bottom right monitors crash frequency and crash type during the COVID-19 pandemic. If you're interested in exploring crashes in your area, definitely go check out tims.berkeley.edu and sign up for a free account. I'm going to quickly go over the 2 tools on the top left, the SWTR's query and map, and then the SWTR's GIS map. For the other tools, go ahead and just go to the website and check them out. Next slide, please. So the SWTR's query and map tool was the first tool SafeTrack developed. It allows users to access geocoded fatal and injury crash data from the SWTR's database. This tool offers descriptive statistics, shows clusters of crashes and heat maps, and allows users to export the data files to do more in-depth analyses. And then for those interested in further data exploration, under our Help tab on our website, we offer a code book that explains all the fields in the SWTR's database. Next slide, please. And then the SWTR's GIS map seen here offers a more map-centric experience to exploring crash data. It allows users to overlay other layers of data on top of traffic crashes, such as the California road system, which shows a functional classification of public roads. For the purposes of high injury networks and systemic analyses, this tool also allows a user to select specific collisions in a region, corridor, or intersection for further analyses. Other features include intersection rankings, collision diagrams, and summary collision statistics. Next slide, please. Thank you so much for the opportunity to speak with you all today and to share some of the resources we have to offer at SafeTrack. If you're interested in a TIMS training or any other technical assistance, please let me know. Thank you.
Thank you, Catherine. I was just on your website trying to see if there were any upcoming trainings for folks to take advantage of. Are those trainings that you described, are those more one-on-one, or are there larger trainings that folks might tune in for?
I don't think we have anything on the calendar right now, but
Okay.
they are definitely, if there's interest, we definitely try to arrange things and get a webinar put together.
Okay, got it. Yeah, because it is an enormously helpful and user-friendly tool. Switters can be quite challenging to, navigate for many of
Right.
us who don't do scripting. So your again, your website is enormously helpful for information. So thank you, Catherine. And if you do have questions for Catherine, please feel free to put them in the chat for folks. I see a comment from Eric coming through. TIMS is also a great resource for roadways that are shared with other jurisdictions where you don't receive their crash reports. So a key thing to be aware of as you consult and try to source your data. So again, thank you, Catherine. I want to welcome Katherine Chen from the Los Angeles County Bicycle Coalition, who's going to be sharing more on a community-based organization's role in supporting or helping shape pine tree networks. Welcome, Kevin.
Great, thanks, Courtney. Appreciate the opportunity to be here today and to share a little bit about how community-based organizations oftentimes use the information from high injury networks to inform our work. So just very quickly, my name is Katherine Chen. I'm the Senior Director for Policy and Partnerships at the Los Angeles County Bicycle Coalition. Next slide, please. So for those of you who don't know who LACBC is, we are the only county-wide advocacy organization for the transportation justice space here in the LA region. Our community programs and rides try to be inclusive and support all experience levels. And our goal is to seek to make the entire LA region a more livable community by increasing transportation access and choice. Next slide, please. So community-based organizations often rely on all of the data that we just talked about, right? So we've heard from Eric and Jesse about two different perspectives in terms of building high injury networks, but we've also talked a little bit about, from Catherine, where that data comes from. And next slide. And so for CBOs and nonprofit organizations that work in the active transportation space, we rely on some of those reports to basically prioritize our work. So oftentimes those high injury networks can inform where CBOs focus their efforts. It may prioritize specifically where we engage with communities, which communities we engage with, what types of engagement happen, where they happen. So, oftentimes the high injury networks inform the routes for some of our rides and activities, because we want to be able to, as I said earlier, we want to be able to be inclusive, and we want to make sure that folks from that community feel safe, that younger or older audiences or people who are less skilled at riding a bike or using other modes of transportation feel comfortable to be able to participate in some of the activities and events that organizations like ours put on. It also oftentimes shapes the narrative around what traffic safety and traffic violence is, and how we define it as not just as organizations, but oftentimes as a society. And so, next slide. So creating that narrative is actually a very important aspect of the information and the data that is provided and collected from those high injury networks. Those high injury networks can paint a picture of what traffic safety means for those communities. And in a lot of cases, as Eric alluded to earlier, the conversations around, the conversations that can be had with members of the community oftentimes focus around what's immediately in front of them, but also at the same time, when they're sort of guided to talk a little bit more about local roads that everybody sort of has a consensus, maybe unsafe for different reasons, but when you show them data, they're able to sort of ground truth and really provide the feedback from the community that says, yes, we agree that there's a problem there and those roads are dangerous. Oftentimes we'll draw from those incidents that get reported for anecdotal evidence to support changes both on an infrastructure level, but more importantly on a behavioral level. And then the power of the stories from victims can really sway elected officials in conversations, and we oftentimes will, where possible, we may identify either victims or family members of victims of traffic collisions to participate in conversations with electeds, because those personal stories can really have a tremendous impact on the thinking of those elected officials. Next slide, please. And then finally, that empirical data is used to create support for legislation. So having the high injury networks and the statistics and information based off of those high injury networks can really help us to identify moments where if there's a piece of legislation we need to be able to work through and we need some empirical data for it, we can oftentimes rely on, if not the high injury network reports themselves, oftentimes we can go to those source data and use that information to help us with creating those persuasive arguments. And then we know that oftentimes that empirical data informs the distribution of funding for many of the projects. So with all of that said, I feel like my goal today is to kind of take us a little bit of a step back from the nitty-gritty details of the data and really take a broader perspective on thinking about what some of the challenges are. So next slide. Actually, we can go 2 slides. Thanks. As Katherine mentioned, the data isn't always perfect, right? And oftentimes we have situations where the data that is collected is either incomplete or sometimes inaccurate. And a lot of that has to do with how that data is collected. Whether it's CHP data or local law enforcement data, sometimes there's a lot of dependency there upon the judgment of individual officers, law enforcement officers when filling out that information. So the fact that, Eric mentioned that for the County of LA, they actually cross-reference that data significantly across multiple sources shows that there's a need to corroborate some of that information in a lot of cases. And even then, some of the disaggregated data that we need in order to really make some deep informed decisions oftentimes isn't clean or accurate enough to be able to give you the level of depth and the level of information that's really truly disaggregated enough or accurate enough to make some of those decisions. And oftentimes the data collection, one of the challenges that we run into, especially when we're talking about severe or fatal collisions, is it can be a little bit one-sided. Victims of fatal collisions don't get a say in the narrative. So we don't necessarily fully understand what happened and whether or not there are witnesses or folks who witnessed the incident. There can also be a level of interpretation. People have bias when they interpret that information. So anything that is shared isn't necessarily always going to be the complete and accurate story. So we need to be sure that we're taking that into consideration. Next slide, please. And finally, these high injury networks do a great job of capturing where incidents are happening, but they may not always point out where the greatest impacts are. And what I mean by that is, right, for instance, Katherine mentioned that near misses are not captured or tracked in a lot of this data. But near misses can have tremendous impact on behavior within communities. If a community is continually experiencing a severe number of near misses, that can change people's behavior. It can change where people walk, it can change where people are biking, it can change whether or not somebody is choosing to use active transportation, it can change where people are having to go in order to access public transportation assets, or it may change people's behavior enough to really have a tremendous impact on that community. The other thing to keep in mind is, while the high injury networks are capturing where those incidents are happening, it's not always necessarily capturing the downstream impact. As an example, an individual who maybe bikes 15 or 20 miles a day to reach their job at in one of the many job centers in the LA region, they may not live anywhere near where a collision happens. And so the downstream impact of them being hit and injured in a severe injury collision, or even killed in a fatal collision, might mean that their family, who is 20 miles away from where that impact is being recorded and where that information is being recorded, the downstream impacts of that are going to be much more severe. Their family, maybe losing a sole income earner. So we need to also think about, when possible, what is the actual impact of these collisions? Is it just the collision itself, or are there more sort of larger downstream social impacts that we also need to be thinking about? Next slide, please. So what are some ways in which we can, what are some ways in which we might be able to address some of this? One is, improving data collection practices. And speaking as someone who is outside of the decision-making process for how that might happen, it is something that, it's easy to say, but it's hard to implement, and we understand that. A lot of our advocacy groups understand that collecting data is a huge challenge. We oftentimes participate in the collection of that data. LACBC, along with some of our partners, including LA Walks, participate in the City of LA's bike pedestrian count to help ensure that data is collected on a regular basis, and that information, which is important in a variety of ways, helps to inform some of those decisions. So we know that the collection of data is challenging, but we always want to strive to do better and improve those practices. Another thing that's really going to be important is educating leaders and residents to understand those broader implications. Again, I talked about the example of someone who gets hit many, many miles away from where they live. So we're not really thinking about the downstream impact if we're just looking at that one collision in its location of occurrence. We really need to start thinking about what are the potential implications that those collisions will have on our society as a whole. And what does it really mean when we see a concentration of collisions and maybe they're happening in a particular time of day? Maybe they're happening to a very particular set of audiences. What are the downstream implications of what that actually means? And what is upstream of that in terms of causes? So carrying through studies and tracking to illustrate long-term impacts on those communities may be important. And then examining to seek out what those root causes are, and not just tackling the symptoms, because in a lot of the tendency is to look at these collisions and say, okay, so we can put in place a temporary or a quick build type of project to change the infrastructure that's on the ground. And yes, that's going to address the immediate symptom of what is causing that impact in that moment, but it may not be looking at the bigger picture of, well, the reason that these impacts keep happening is because we've got a large concentration of people who are coming from a large distance away who don't have access to reliable public transportation. So they're forced to walk or bike significant distances in order to access where the jobs are located. So how do we address that? How do we look at how land use and zoning and all of the other things, the tools that are available to municipalities, how do we examine that and look for additional things that actually address the upstream causes of what is actually creating that high injury network? And finally, it's important to remember that we want to identify and prioritize solutions that really put people first and look at what the impacts are on people and make sure that we're not just trying to create infrastructure, because infrastructure, again, it's oftentimes addressing a symptom. But if we don't look at upstream what the larger implications are, and we're not looking at what those root causes are that are really leading to these high numbers of collisions, then we may find ourselves just continuing to be in a cycle where we're trying to address symptom after symptom without ever really tackling the root cause. So I believe that's my last informational slide. We've got some resources that I've shared here. And then finally, I do want to point out that for the LA County Bike Coalition, next slide, we have a number of chapters all throughout the county. So if one of your cities shows up on this list, I'd be happy to connect you to our local advocates in your community who can really help you with identifying and working in those local communities to really make a difference.
Thank you, Kevin. Thank you for that presentation. I think as you were describing, you really helped us take a step back and consider, the qualitative element of this and the community engagement side of it, and how, it's not entirely data, right? There are people behind it and other considerations that need to be considered, right? As we're focusing so hard on these technical pieces. I think that perspective is certainly enormously appreciated and valued. I do have a question for you regarding your work. If you can identify a barrier for you as a nonprofit, a community-based organization, in getting involved in safety efforts at city levels or county levels, is there anything that folks in government can do to make it easier to engage groups like yours and residents?
Sure. I think something that is constantly a refrain from the community-based, the CBO community is the lack of access to funding options and funding sources, and not just specifically for us as CBOs, but really to actually pay for the expertise of the community members themselves. So we frequently find ourselves in situations where we want to bring people from those lowest income communities in, but they don't really have the time to invest in participating in a lot of those engagements and activities for free. We've got to find ways to be able to compensate them so that they can actually prioritize participating in that, participating in that engagement rather than worrying about whether or not they're going to lose their job, or whether or not they're going to have to work that extra hour somewhere else. Like, we want to make sure that people in the community are paid for their time and their energy and engagement. And really, we all know that those community members really are the experts in their communities, and they understand what happens on a day-to-day basis because they're there all the time. We, as outsiders, we are coming in, we are trying to learn and learn from them. And so we want to make sure that they get compensated adequately. And I think, we're starting to see this more and more. I appreciate that in the past, SCAG has made efforts to make that type of funding more readily available. We'd love to continue to see that trend in the right direction and make sure that community members have the opportunity to participate, and that we really do get a truly broad and diverse set of perspectives that actually tells us what the real members of that community are experiencing.
Yeah, certainly an area to grow. I know sometimes with contracting and such, it can be hard for some of our governmental agencies, but I think they're getting that feedback loud and clear that we need to do something, right, to diversify the folks that we are reaching and partnering with. So again, really appreciate and value the feedback and the perspective that you've shared, Kevin. I know that we have 5 minutes left. Pam, would you care to take over? I know we had meant to do breakout groups. I don't think we're going to be able to do that, but we can post some questions and share some reminders really for next week's session. Yeah.
Absolutely. And thank you very much, Courtney. We don't want to keep people past the 2:30 hours. So I did want to ask one question though. It's really the purpose of a peer exchange is really to get you thinking about how this applies in your own community. Is there anything that you heard today that made you think, that could be something we could do in our community? We could establish a high injury network. Or if you have one, maybe you could improve it. And you can either answer by just, unmuting yourself and asking the question or commenting, or you can just put something in the chat pod. And also, I'm not above calling on people, so. Anybody? Victoria, if you're, I see that you're still here. You had indicated in a comment that you thought high injury networks only happened in Vision Zero cities. So I'm guessing you don't have one in your community. Is that correct? Are you there, Victoria?
Sorry, Pam, I got my
No
buttons
problem.
all mixed up. Yeah, hi. Yeah, so just so you know, I work at the state level. So and I've become more familiar with SCAG's work and all of the high injury work that's happening around the state, a lot mainly through the group that Courtney has pulled together. But I feel like I have done a little informal queries on my own, just to you know, those that aren't working on this high injury network guidance, and it is a little unfamiliar, you know, territory for a lot of other local jurisdictions that I'm familiar with, that, you know, might be smaller in population size or just, you know, more geographically spread out. So it's, you know, I'm so excited to be part of the working group that SCAG has pulled together to kind of look critically at this, you know, defining high injury networks and sharing existing methodology and in terms of, you know, but yeah, I feel like there's also this like whole other group that I'm, you know, connected with that is outside of this kind of technical loop, and I like that Kevin was kind of alluding to, you know, really making sure that this is just kind of seen as one piece of the bigger puzzle of addressing safety, and you know, and I appreciate him using the term traffic violence, because, you know, there's definitely, you know, an element to that that we haven't really even touched the surface of. So I think there's just a lack of familiarity kind of beyond some cities that have really embraced Vision Zero, and so I'm interested in the uptake of that knowledge elsewhere. And you know, and I'm sure that's connected to kind of staff capacity and resources, but I think there's also just some basic you know, it's like people aren't really ready for that conversation, or they're not there, or they're engaged in it, or they're, you know, there are other priorities. But I just feel like there's, you know, there's a little disconnect from my where I sit in Sacramento at the state level with, you know, who's actually embracing this work right now.
Courtney, did you comment on that?
Well, I just want to say, I mean, we have a minute left, and I just want to tie back to what Victoria shared, is that, you know, some of the smaller cities may not have the resources. I think that's come up repeatedly, right? Is that this can be a technical, really intensive activity that should include good community engagement throughout, right? And qualitative assessment as well. And to do that, again, funding may be needed. So our next peer exchange next week is going to be focused on funding strategies. So that's an invitation for everyone in the room today to consider signing up for that as well. And we also have included links within the chat for folks to share, to evaluate the experience today, since we have 11 more peer exchanges coming up, and we definitely want to grow and improve and provide good experiences for everyone. We've also linked to where the recordings are going to be posted later this month. And I do see one last minute comment coming in from the County of Ventura, that they have a local road safety plan that focuses on proactive systemic improvements on similar types of collisions in similar geographic atmospheres. And I see that the question is, can you explain the differences between a high injury network and a local roadway safety plan? Again, we're at 2:30. I think what we can do is clarify that distinction. I think from my perspective, a high injury network can become a part of an LRSP or a part of a Vision Zero plan. It's not a standalone piece, as we described. It should be part of a larger, comprehensive effort to advance traffic safety or transportation safety in a community. And with that, sorry, we just ran out of time. Pam, any additional final words? I know I mentioned the evaluation link is in the chat, link to where you can find more peer exchanges to sign up for. We do want to thank you for taking the time to spend with us today. And we hope we can see you again, or hear from you again next week and the subsequent weeks when we host more of these. Thank you to all our panelists, of course. Much appreciated for your time. And thank you everyone again.
Thank you.